During the International Congress of the MDS, we presented a poster on our study on the developmental validity of the revised improved version of the Fragile X associated Tremor Ataxia syndrome rating scale, the FXTAS rating scale. So clinometric analysis of the first version of the FXTAS rating scale showed weaknesses needing revision. The cognitive pretesting is a qualitative approach used in the scale development preceding field testing to assess the difficulty of examiners and examinees in completing the instrument. So the objective of this study was to qualitatively validate the revised improved version of the FXTAS rating scale for motor signs assessment. We used rounds of cognitive interviews conducted with a convenient sample of 5 movement disorder specialists and 5 patients with FXTAS, following a semi-structured script and notes to determine whether the revised improved version of the FXTAS rating scale is comprehensive, and relevant to capture the FXTAS motor signs. Insights gained from participants' experience using the FXTAS rating scale weren't subject to verbal protocol analysis, the VPA. The VPA data were then categorized according to the comprehensibility, the comprehensiveness, and the relevance criteria, and were incorporated into the revised improved version of the scale between the rounds. The results coming from this study is that after the second round of the cognitive pretesting, data saturation was reached and no further adjustment were required on this new version of the FXTAS rating scale. All insights incorporated into the revised improved version of the rating scale were categorized as comprehensibility criteria, since for all participants the revised version met the criteria of comprehensiveness and relevance. So the conclusions coming from this study is that using an iterative approach of the FXTAS rating scale demonstrated to be comprehensive, and relevant to access motor signs in patients with Parkinson's disease. The developmental validity of the revised improved version of the FXTAS rating scale was established with the participation of professionals and also patients, and now is ready for field validation. This is the first rating scale developed for this contest, and we are pretty confident that the validity, the criteria for the validation of this rating scale will be achieved on the next step.